Hello, my name is Unique. I'm from Southern California, and I recently just had a cervical surgery from Dr. Bertignoli, which was 2 levels. My history kind of starts where I was injured in the lumbar region. My L5-S1 was herniated, and I decided to go in and have a microdiscectomy. And a couple days prior to that, I woke up and couldn't move my neck very well, just out of the blue, and found that there were 3 discs blown in my cervical. So I went in for the lumbar surgery, had the microdiscectomy, went in a week later and had a fusion to one of the vertebrae in my neck. And upon going to physical therapy, I was re-injured in my lumbar and tried every alternative possible that I found. I did prolotherapy for a year or so, I did traction for a year or so, I did massage therapy twice a week, and any type of therapy that I could find I did. I swam, I tried to walk, everything possible. And unfortunately none of that worked. So through one of my doctors, I came in contact with a gentleman named Mark, who looked over my case and set me up with Dr. Bertignoli over here in Germany. And we decided, after sending all of my films and everything for the lumbar, that the best thing to do would be to get a disc replacement there. So we flew over, and I had the disc replacement about 3-4 months ago in my L5-S1. When I got here, however, my neck pain was getting so severe and the headaches were so extreme that I decided to have him get some films and check that out. And we found that the 2 discs that remained in my neck that weren't fused and hadn't been addressed were severely herniated, and we did a discogram, and they were both pretty trashed and pushing on the spinal cord. So I decided to go home and recover from the lumbar surgery and come back here 3-4 months later, which is what I'm doing right now. The surgery went really, really well. It was much easier than the lumbar surgery, but even the lumbar surgery was not that bad. I've been more than pleased with everything. The healthcare system here seems phenomenal in comparison. The nurses are nice and kind and talk to you and want to help versus what I found in the States, unfortunately. Thus far, everything's been really easy. All the post-op stuff, everything that, in terms of pain that I found, the 2 lumbar disc replacements, the 2 disc replacements that I've had have been much easier to heal from, to get back on my feet, versus the 2 surgeries that I had in the States. And one of the things that I found is, with the amount of medication that they give you in the States, it's very difficult to heal properly. So coming here, there was no morphine, none of that, but it wasn't necessary. And the pain pills that I've had have been sufficient, and they haven't made me loopy or drowsy or anything, which complicates the healing process. So right now I think I'm 4 or 5 days out of surgery, and I'm walking around and feeling good, and have pain, but it's you know, if you've had lumbar or cervical pain for years, this is nothing. This is no big deal. I think that's it. I don't know what else is